Martin Shkreli is the former CEO of Turing Pharmaceutical, who's responsible for hiking the price of at least one drug by 5,000%.
Are you going to change the price?
No.
Did aggressive marketing tactics get doctors to prescribe drugs that people didn't need, or worse yet, that might have caused them harm?
So the health insurance gets a cut, the pharmacy benefit manager gets a cut, the drug manufacturer gets a cut, and the patient gets screwed.
Across the nation, people are rationing insulin, splitting pills, and choosing between groceries and prescription medications. Somewhere along the way, life-saving drugs became luxury goods. This episode isn't anti-medicine. It is against turning survival into a sales strategy. Because when a drug costs $30 in Canada and $300 in the United States, the problem isn't chemistry, it's not R&D, and it's not supply. It is capitalism. So today, we are unpacking the truth about pharmaceuticals. The billion-dollar maze of patents and shady rebates and legal loopholes that turn medicine into monopoly. This episode is going to cover three main topics. Number one, evergreening. Number two, pay for delay. And number three, PBMs. Not PBJs, PBMs, which are much less delicious and much more malicious. Wow, I came up with that on the fly, and that rhymes. Anyways, let's get into it. Let's start with number one, evergreening. When we think of Big Pharma, we think of monopolies, expensive life-saving medications owned by one or two major companies, and they don't go on sale even if millions of people die. Not their problem, right? Evergreening is this practice that sounds pretty cute. It sounds like something you do to your houseplants, but it's actually the mechanism of extending patents over and over and over again to maintain market control, which is one of the ways in which pharmaceutical companies maintain and form monopolies. Evergreening is a practice of tweaking an existing drug, maybe altering the dosage, the coding, the packaging, just enough to get a new patent. So the standard patent for new medications is usually 20 years, unless you improve it, quote unquote, improve it, which means you can file for a new patent and extend it. And you can do this over and over and over again as many times as you'd like in the United States, of course, because it is completely legal. And so many pharmaceutical companies don't actually improve the drug at all. They just change the coding or change it just enough, maybe increase the dosage so that you have to take it once a day instead of twice a day, but it's the same exact formula, it's the same exact pill. And so they file for a new patent and can get anywhere from 10 more years, 20, 30, 40, etc. They can keep doing this forever, and they usually do. According to the Initiatives for Medicines Access and Knowledge, aka IMAC, the top 12 selling drugs in America filed for 71 patents each, amounting to an average of 38 years of exclusivity for each of those drugs. This means that you can block out competition completely. No other generic medications can come into the market and drive down prices. And when you have that kind of market control, you can set any price you want. And there is no legal limitation to this. Surprising, right?
No, not really.
Let's take an example of one drug that took this to the extreme, Humira. Humira is used to treat rheumatoid arthritis and plaque psoriasis in adults, and in children it can treat Crohn's disease and ulcerative colitis. So this drug was filed for 130 patents and still goes for $7,000 a month. Now imagine people who are uninsured or underinsured who can't access this medication that could literally be life-saving to them, or, prevent disability so much earlier than it would have happened with these disorders and diseases. Unfortunately, there's nothing that can be done about it because they just kept tweaking and tweaking and tweaking until they filed for those 130 patents. Let's look at another example, Sovaldi. This is the miracle hepatitis C drug, and no doubt a medical breakthrough, absolutely. But it goes for $1,000 a pill, which means that a full course is $84,000. You tell me what American can afford $84,000 for one round of treatment for a disease. And this is a disease in public health we are trying to control and trying to keep at bay. So it is in our best interest for these transmissible diseases to treat them right away, very quickly, and very efficiently. But we can't do that because most people can't afford the drug. The problem is that Gilead, the pharmaceutical company that invented Sovaldi, didn't really invent it at all. They didn't really spend all that money on the R&D, the research and development that most pharmaceuticals point to as the reason drugs cost so much. Actually, you did. You paid for most of the science. So the NIH actually does most of the basic science research that goes into pharmaceuticals and like making pharmaceutical drugs. And our taxpayer dollars fund the NIH research. And then companies like Gilead and many others come and take that basic science research, build upon it. I don't want to say ever so slightly, but kind of. They build upon all of that research to create that drug. And then they say, oh, well, R&D costs like $1 billion, $2 billion, but that's false. And we will get to that, all the lies we are told about R&D. I could go on and on with these examples because there are so many, unfortunately. But last one, and this one is really interesting and it should really piss you off because it pisses me off. Insulin. It's a 100-year-old discovery, and yet prices have tripled since the early 2000s. How can that be? Something discovered so long ago that is still in use and commonly triple in price. Well, the patents that the pharmaceutical companies file are not for the drug itself, but for the accessories, the insulin pens, the timers, the digital monitors, etc. And then they can jack up that price and basically file for a new patent so nobody else can do it, like generics. This has taken, it's like the same concept as taking a brick and then slapping a touch screen on it and calling it a breakthrough and then selling it for $1,000 per brick with a touch screen. It makes absolutely no sense. It's not innovation, it's capitalism. It's a rent seeking business model wrapped up in a lab coat. It's insidious. Okay, I'm angry, you're angry, we're all angry, but I don't want to dismiss that some tweaks actually do improve patient experience. Like some pills are tweaked just enough so that the coding is a little bit better and patients can experience a better time ingesting them without having heartburn or creating ulcers, etc., etc. So, yes, some tweaks are actually very good and very beneficial, but most tweaks are in fact about market control and not about improving patient experience. I don't need to tell you that Big Pharma doesn't really care about you. But if you did need someone to tell you, I'm here to tell you. Okay, now that we've understood evergreening, let's understand pay for delay. So if evergreening doesn't work, don't worry. You can always bribe your competition. And that is what pay for delay is. So this is basically when brand name drug companies pay generic manufacturers to delay the release of a cheaper version of their drug. It makes sense, and it happens quite often. The Federal Trade Commission, FTC, actually estimates that these anti competitive deals cost American taxpayers $3.5 billion in excess. That's a lot of money. But it's kind of a win win for both the generic drug manufacturers and the brand name drug manufacturers because they pay a lot of money. Think about if Nike were to release a new shoe and they realized that Adidas was about to release kind of the same shoe but a little bit cheaper, and they're like, wait, we'll pay you $2 million to not release that shoe for the next 12, 13 months. Sounds like a deal? Adidas is like, yeah, sounds like a deal. This is exactly what's happening for cancer medications, blood pressure medications, all kinds of life saving drugs. And again, it is completely legal in America. Let's take Provigil, for example, a drug that's used to treat narcolepsy and other sleep disorders. Really important medication, not very cheap. So, Cephalon is the drug manufacturer for Provigil. And when their patent was about to expire, they went and they paid off all four competitors over $200 million in total to delay the release of the generic. And patients who really needed it were paying the price for that, literally, for many, many years. I mean, this wasn't part of my script, but this is a really good time to tell you guys, if you didn't know, that generics are fine. I know you walk into a CVS pharmacy and you're trying to, let's say, decide which headache medication you want to take, and you see the CVS brand and then you see the name brand of Tylenol or whatever, and you're like, ah, but the name brand must be better because it's the name brand. No, it's not. Trust me, it's not. In 99% of cases, it is the exact same formula, the exact same coding, the exact same dosage. You can even flip it over, check yourself, look at the active ingredient, and see if there are any differences. There are not, but there is a significant difference in price. But pharmaceutical companies are banking on you thinking that the brand name is going to be better somehow, some way, that it's going to be more effective. And they do this through a lot of advertising and brainwashing. But if you didn't know, now you know. It is okay to get the generic versions of your medications and save a lot of money. Trust me, it's not going to hurt you. But as always, check with your doctor before you take any medication. I am not a doctor. I'm not your doctor. But I'm just saying, don't be afraid of generic medications. They're completely safe. They're fine. Usually, they wouldn't be sold if they weren't. Obviously, our FDA needs a little bit of work, but for the most part. Okay, deep breath. Let's reel it back into pay for delay agreements. So, according to the FTC, there's this 2010 study that found that these reverse settlement agreements that usually included compensation, which means that the brand name actually paid the generic to delay entering the market, resulted in about an average of 17 months of delay before generics could enter. This means that the brand name pharmaceutical companies were able to protect tens of billions of dollars in profits. And the people who really needed those drugs paid the price, literally, for so much longer than they should have. Because when generics are delayed, prices stay at brand name level, which is often 5 to 10 times higher for the same exact medication, the same exact formula. And that doesn't just mean you're paying more for the medication itself. It means you're also paying higher insurance premiums, you're paying more copay, and Medicare and Medicaid costs explode. So, in effect, pay for delay agreements turn a drug, which is something that's supposed to become cheaper with time, into this perpetual money making machine, as does evergreening and a lot of other tactics and loopholes they use. So, now let's talk about why the drugs are so expensive in the first place. Well, as I said, pharmaceutical companies like to point to R&D as to why a pill can cost $200 and nobody can say anything about it. But are they actually spending that much money on research, or are they lying like they do about everything else? Let's look at numbers. Okay, so the average cost we've found for R&D that pharmaceutical companies spend on R&D is between $708 million to $1.3 billion from start to finish. And this, they include opportunity costs and failed projects and staffing, etc., and R&D along with that. Those numbers might seem really large, but they're actually far lower than what pharmaceutical companies claim to have spent on producing the drug. But here's the kicker. Even that is kind of a lie because they're not actually spending that money on research. Who is? You are. Great question. Taxpayers are spending most of that money on most of that research. And that's because most of the research comes from the NIH. According to a study between 2010 and 2019, NIH funded research was linked to 354 out of 356 FDA approved drugs that were released. That's literally only 2 drugs that were not linked to NIH funded research. And the NIH funded research we're talking about had costed around 187 billion, with 83% of that going to basic research and 17 going to applied research. This means that they just take that research and piggyback off of it to produce their drug and then say, we paid the full price. But it's a scam. I don't mean to laugh. I laugh out of sheer anger. Um, and and about the absurdity of it, really. I laugh when I learn these things because it is so absurd that it is legal and it is happening over and over and over again, despite people, you know, either forming disabilities because they can't access their medication or at least not access a full course of it, or because they're dying, or because people become homeless because they need to choose between paying rent and paying for medication. People send their kids to school without an extra EpiPen and risk having an allergic reaction that might be lethal in some cases because EpiPens are so darn expensive and you can't afford one for school and one for home. This is real. This is the experience of millions of Americans every day. And it is absolutely bonkers to me that we live in such a system that is legal and is common, you know? And so if you see me smiling, it is not because this is a humorous topic. It is just because it is so deeply absurd. And there is really nothing to do but laugh. I mean, You could be angry with me, and then we could fight the system. But until then, what we have now is access to knowledge and educating ourselves about what's really happening. And, when we have this knowledge, we could elect our representatives a little bit better. We could understand this. We could go into the fields that matter so we can change the system. Because we, right now, the people who are probably watching this, who are in my generation, we are the future and we can build a better future. Okay, I didn't mean to go on this like long inspirational tangent or speech, but yes, let's go back. Backtrack once again. I keep getting escalated in this. Let's go back to costs. Where is all their money going? If it's not going to R&D, it must be going to something, right? It's going to marketing. Surprise, surprise. There are two types of marketing, direct to physician and direct to consumer. Direct to physician is actually quite common and quite legal in a lot of countries with limitations, but direct to consumer is only legal in two countries, the United States and New Zealand. Now, New Zealand, let's kind of take it out of the equation because they also have a lot of restrictions and a lot of laws, protecting consumers and making sure that that direct to consumer marketing is fair and not too pushy, if you will. So let's look at America, the only country in the world that allows for pharmaceutical companies to create all of these thousands of commercials about ask your doctor today, with like someone really happy dilly-dallying in a field of green about this like condition that you've never heard of with a medication you've never heard of, and then the side effects are, side effects include vomiting, diarrhea, loss of vision, loss of balance, kidney failure, liver failure, seizures, maybe death. So I mean, you've seen the commercials. You can't be an American citizen and not have seen these commercials ever since you were a little kid, when you were watching television, all the way up until right now, where you even see them on YouTube ads and game ads. Like even when you're playing games, you get ads. And sometimes you get pharmaceutical ads. It's crazy. Anyways, that money is mostly going on to marketing. Wow, I can't speak. Okay, so how severe is this problem? Well, one 2019 JAMA article suggested that in any given period, drug makers are spending $30 billion on marketing alone, overshadowing their R&D budget in most cases, which is really ironic. Now let's talk about direct to physician first. So direct to physician means that a pharmaceutical representative will go into a physician's office and basically offer the physician all of these perks, a jet to holiday, a seat at a conference, a chance to speak at a conference and elevate your career. So all these holidays and free samples and free drinks and free dinners and luxury hotels, all to build that loyalty to the brand so that when a patient comes in, they can recommend that drug first, or in some cases even push for it. I have been at a doctor's office where the doctor was so suspiciously pushy for this one medication, and there was like some resistance because in the back of my head, and I hope in the back of your head, you have this voice telling you like they're paid off by the pharmaceutical company, and it's really obvious when they're so pushy and they mention the drug like 19 times. The physician shouldn't do that. Okay? Okay. Be wary, and not be wary, but be aware. Like, obviously, follow the treatment plan that your physician recommends you. Of course, I am not advertising for a distrust in medicine and your physicians, but it is good as a patient in this day and age, in this country, to just be aware and involved in your treatment plan and the decisions that are being made about your treatment plan. Ask a lot of questions, get second opinions if you can, do some research on your own, just be involved. Because doctors are not immune to persuasion. In fact, as of 2018, 75% of physicians had some kind of tie to a pharmaceutical company, which means loyalty to a pharmaceutical company. And you take that as you may. Okay, moving on to direct to consumer, which are those eerie, weird commercials that make you feel uneasy and like, do I have that? Because at the end of the day, they're not just selling cures, they're selling conditions. You're a little tired, that might be like this seasonal affective disorder disability TM, and we have a drug for that. And if it causes headaches, we also have a drug for that. And if that drug causes a stomach ache, we also have a drug for that. Not to worry. Okay, so the FDA like loosened its rules in 1997, and we saw costs for direct-to-consumer marketing explode from $1 billion a year to $6 billion a year on average, just on these commercials alone. So even if they couldn't persuade your physician to recommend that medication to you, not to worry, because the patient has probably subconsciously absorbed that information and had gone into the doctor's office already insisting on a certain drug, and this happens quite frequently. Patients are requesting drugs like products at Sephora. They go in and they're like, I have this and I want this drug. And physicians are usually rated on patient satisfaction, so a physician is going to try and satisfy you if they can, obviously not, risking your life or a misdiagnosis or a mistreatment, but if you're being really pushy about a certain drug, but there's like another generic or another drug that works just the same, they're probably gonna just prescribe you the drug you want, right? Because they want to see you satisfied. And a lot of times, physicians don't tell you that the generic is just as good or that there is a generic at all. And then if there is, maybe your insurance doesn't cover it, but we'll cover that in just a second in PBMs, that whole formulary that exists when you walk into a CVS and they're like, this one isn't on your insurance, but this one is. We'll talk about that. I'm getting ahead of myself. Okay, so as you can see, this entire ecosystem tilts towards overprescription, it tilts towards brand name loyalty, and towards healthcare as marketing. It's a business model. But anyways, now let's move on to pharmacy benefit managers. PBMs are the shadowy middlemen that are supposed to negotiate prices for us, but actually are behind some of the most infuriating drug price hikes in America. They're supposed to protect us, but they became profit maximizers. Let me break it down for you. So, originally, PBMs were meant to negotiate in secret between pharmaceutical companies, insurances, and pharmacies. So, basically, they're just supposed to like get you the best price, make sure, like everybody's getting a good profit, everybody's happy, you're able to afford the medication. But that's no longer the case, because anywhere there is to make profit, you lose all sense of morality.
Big Pharma.
Okay, so let's say a pharmaceutical company comes up with a drug and there are other kinds of manufacturers for this. PBMs go in and negotiate prices with them and they negotiate discounts. Okay? And then, based on that, they decide which drugs go in order on your formulary or your approved shopping list. So, which drug will be recommended first, and then second, third, fourth. These are tiers. And, the one on top is usually the one that the PBMs have selected as, the best outcome to the negotiation. But here's the thing. PBMs make commission in some capacity. If you want to really simplify it, it is basically commission. The higher the price of the medication, the higher the rebate, the more money PBMs make. So it's actually in their best interest not to keep prices down because they want to make a larger percentage of that money. And that is why when you walk into a CVS and you try to get this medication, they say, sorry, that one's not approved, but this one is. And that should tell you that a PBM did that. They're at fault there. And because these deals don't necessarily have to be transparent, again, these rebates can be kept secret from patients and insurance plans. The drug manufacturers can work with PBMs for favorable placement on that list. In essence, to be on tier 1, to be recommended first before any other medication, even if all the other medications do the same exact thing. So it's like this perverse system of markups and discounts, and basically the drug company jacks up the price, the PBM demands a rebate to keep it in favorable placement, and that rebate is a secret and no one can know about it because there are laws protecting against that, and then, or not protecting us, but protecting the PBMs and the drug manufacturers, of course. And then your copay still somehow went from $10 to $300 overnight. And you don't really understand why, because isn't the PBM supposed to protect us? Isn't it supposed to help us? But no, they have no interest in lowering drug prices because then they won't make as much money. And that doesn't really make sense now, does it? Actually, one study found that 1 in 4 Americans had to cut costs on other things or skip medications just to make ends meet. When you have a medical condition, that's a financial identity. That's the difference between, remortgaging your home and not, paying rent and not, being able to afford groceries or not. Most Americans are one paycheck away from poverty. And that one paycheck could very well just mean a cough or asthma or an allergy or needing an EpiPen. Having one disorder, especially for the uninsured and underinsured, that's a big deal. And, I didn't realize how privileged I was because I have, good health insurance, and I'm so lucky and I'm so grateful for that. Um, and I meet a lot of people who are uninsured. And, I talk about healthcare as something so freely accessible because I am privileged and because I don't realize what I don't have. And I speak to people who, I recently met someone who got seriously injured in the snow in the blizzard, and they fell and they like completely injured their arm. And I was like, you need to go get that checked out. That's inflamed, that's swollen, that could be a fracture that is going to worsen. You need medical attention. And the person just looked at me and was like, I can't afford that. I don't have insurance and I can't afford to go to the doctor. And it just struck me. And this happens quite frequently in my life where I meet people, especially nowadays, people in their late 20s who maybe are not on their parents' insurance, or they're working part-time jobs, or they're unemployed and they're not in school. This like age where, you are very prone to being uninsured, and they really just can't seek medical attention for very urgent medical conditions, for injuries, for things that are very serious. And it just breaks my heart that that's the country we live in, you know? And even if you do have insurance, you can't afford the copay. Even if you have really good insurance that you're paying so much money to have, you still can't afford to go get that medication. Maybe you can afford a consultation and that copay, but you can't afford the medication. I know tons of people who have to choose, every year. They're like, through their job insurance, they're like, should I use my insurance to go to a primary care physician? Or should I go to the dentist? Or should I go to, a rheumatologist? Where do I go? Because I can only pick one. There's a cap to it in most cases for work insurance. So these are actual experiences. I mean, people are taking half doses of medication, if not skipping it altogether, of things they desperately need. And that should really piss you off and scare you that we live in a country like that. Because while CEOs of these companies are going on TED Talks and talking about breakthrough and innovation, millions of Americans are literally Googling how to make insulin at home. Insulin, something we discovered 100 years ago and costs pretty much nothing to make. It is so cheap to produce insulin. And yet, that is like a commonly searched thing. People are trying to make drugs at home. And oftentimes, I mean, we saw during the pandemic, when people try to create treatments at home, it does not go very well. It actually causes more harm than good. Okay, I need to reel myself back in because I can go on these like fight the system speeches whenever you give me a chance. But let's talk about what we actually need to do as a nation, as a government. We need transparency in PBM contracts. We need to be able to see what's happening with those rebates. We need patent reform. We cannot allow for companies to continue evergreening and file for 130 patents for simply tweaking the drug or its packaging. That is not okay. We need generics to enter the market as fast as possible. And they're already given 20 years of exclusivity. They really don't need more than that. We need to end pay for delay. We need to make it illegal. We genuinely do. And we need to allow for Medicaid and Medicare to actually negotiate prices with drug manufacturers. And you might say, like, these things seem crazy, but it's what every other country in the world is doing. In other countries, insurance plans are able to negotiate prices with drug companies. They are able to do that. But Medicare and Medicaid cannot for some reason. And in other countries, pay for delay is illegal, 100% illegal, not even like capped. It is just illegal. And yet, it is legal here with a cap, of course. But again, that cap is not really met most of the time. We need to promote generics. We need to rein in direct to consumer ads. We need to have more laws protecting us against these advertisements and against advertising to physicians with such, ferocious and large sums of money and deals. That wasn't the way to articulate it, but basically, it should be illegal to send a physician to a Jet2 holiday to Thailand and give them, the stay at a luxury hotel just so that they have this brand name loyalty. That should be illegal. It should be. It's not, but it should be. The point is, a better system is possible. It is happening all around us. I am not advertising for something that has not been done. It's not idyllic. It's not this like ideal fairyland world. This is happening all around us. America is one of the only countries in the world that operates like this. It's a sick care system, it's a patchwork system, it is not a healthcare system. And while most countries in the world actually have a vested interest in keeping their citizens healthy, we have the opposite problem. They have a vested interest in keeping us sick. Maximize profit, maximize suffering, maximize profit once again. The pharmaceutical company is like embedded in, or companies they're embedded in our government. Okay, they have a vested interest in making sure that we have these conditions for as long as possible. Chronic illnesses are so incredibly profitable. If you're more interested in that, I have this tidbit in my episode about is the US government poisoning us? And I talk about how incredibly profitable it is for someone to have diabetes because that lifetime cost, it's really high, and it's much more profitable than preventing diabetes in the first place. A doctor is not really incentivized anymore to tell you to eat better or move your body or try stress reduction or try not eating McDonald's when, the lifetime cost for treating you and seeing you over and over again with like a chronic illness that doesn't go away is so much higher. It's just more profitable. We live in a system that is banking on us being sick and that is making sure we are sick, and then creates monopolies so that we can't really afford those medications. But even if you can, you have to sacrifice so many other parts of your life to stay alive, to access those medications. We need a better system, and we need to fight for a better system, and we need to learn about what's happening right now. And so, my fellow Americans, I hope this episode was insightful and it rage baited you as much as it rages me and rages me. And yeah, I wasn't the most articulate because I feel like I'm just like brushing off my skills. I'm still a little bit rusty. I haven't recorded anything in like 5 or 6 months. I've really missed this. I've really missed you all. I'm so excited to talk to you guys about all the things you guys want to talk about and I want to talk about. So drop a comment down below. What was the most interesting thing you learned? What makes you the most angry? Do you have an experience that relates to this? And also, what do you want to hear next? What did you like about this? What can I do better? How can I say things better? I'm open to feedback and criticism and all the conversations you guys want to have because I'm doing this for you so that knowledge is accessible and free and everybody can walk around empowered with the knowledge of what's happening around us. And with that, my lovely, lovely, la, 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 la. And with that, my lovely, lovely humans, I am done concluding this episode. I hope to see you next time. Like, comment, subscribe, share it with someone who might find this interesting, and I will see you next time here on this channel.